I'm Gautam Khanna. I am the CEO of PD Hinduja Hospital and Medical Research Center at Mumbai. We've always been concerned about the rural population of the country. And whatever we have done based on the values of our founder. In fact, it was our rural program got a major push a couple of years ago through our chairman, Mr. S.P. Hinduja, when we started the program called Serve with Passion. And as a part of that program, what we do is we have sent our mobile vans, which are actual buses, which are converted into mobile hospitals and clinics. And they go to the rural and tribal areas outside Mumbai, which is around 100 kilometers or so in the tribal areas. And these vans are in a hub and spoke model. So there is a larger bus, which is in the headquarters, while the smaller buses go into interiors of the villages. So right now what we are doing is we are covering around 33 villages, and we have treated almost 100,000 patients till now. And the population of this area is very, very poor. They're tribal and they have no access to electricity. They have no access to basic care. So we started with taking care of the basic health, but then we found that to impart basic health, you need to educate them on health. So when we started doing the education on health, so we've started now a program for the pregnant women. So we adopted the pregnant women of that area, and we are taking care of the nutrition. So what we are trying to do is trying to give a holistic health picture in that area. So we are giving the treatment, and we have doctors, nurses, technicians. We have a lab in the bus, we have a stat lab in the bus, we have X-ray facility, and we have basic consultation facilities. We do the education program for children. We provide all the hygiene training. We provide basic food. So that is our way of working, and we do it in a district called Jawahar in outside Mumbai, in Thane district, and in Silvassa, close to Mumbai. So we have around 12 buses running right now. Medical staff, the doctors, the nurses, the staff, they all come back here on Friday. So Monday to Thursday, they have a schedule that every Monday they go to this village, every Tuesday this village. So there is a schedule of how they cover all the villages. Every Friday they come here and discuss with the doctors in our hospital here about each patient and what needs to be done. And so there is a direct link between us and those patients in the rural areas. In our hospital, we have designated 10% of our beds for free patients. So we provide them treatment completely free of cost. And for 10% patients, we give them up to 50% of cost. We give them the treatment. Plus, and this is as per a High Court scheme, as per our income level. But when people exceed those income levels, but they're still poor, we know that they're poor, we also provide from our discretion, we provide charity to them. So we have a department called PRD. So they assess their income status, they assess all, and then it goes through the process and we just treat them. Our motto for the hospital is quality healthcare for all. So and this is given by our founders. So what that means is the terms which are important here is quality, means quality for everybody. It doesn't mean only for one segment of the society. And quality healthcare for all means irrespective of race, caste, gender, economic status, everybody gets the same treatment. Telemedicine is very useful, and it has its applications where it is difficult to access areas and the doctors and nurses cannot reach the patient. But in my view, there is no substitute for a physical interaction between a patient and a doctor. And if we can provide that, definitely. But in case tomorrow there is a situation where we are not able to provide physical access to doctors, then we may use telemedicines, but we have not done that as of now. Our research department has been very well established. And in fact, our clinicians and our lab research team, they publish lots of papers. More than 100 papers are published every year. We were the ones who identified the XDR in a couple of years ago. So we've been proceeding with research, and the highlight of that was that this year in April, we had a workshop with NIH of US, and so that was a joint workshop on infectious diseases. We've signed an LOI with NIH, which is called HIMAT, which is Hinduja Institute for Medical Research and Technology, and so where we are going to do joint research with NIH. So our commitment to research is very, very, very strong. So technology, in my view, can be used in many areas. So when you're talking about patient care, so we are utilizing technology to ensure that we minimize inconvenience to them, we give them ease, we make them satisfied. So for example, the options of digital payments, the option of payment on online, and even before the demonetization was announced, we had initiated online payments, we had mobile wallets, we had, of course, credit card, debit card. So there was a lot, and we were giving an incentive to people to go online so that they don't have to stand in queues. So what our objective is, that if somebody wants to book an appointment with a doctor for, let's say, OPD consultation, they pay online, print it at home, no need to stand in the queue, just go straight to the doctor's clinic and you save time. So that's one example. The other example is that we are now doing a pilot study for making a one number dial in for any patient complaint. Just call one number and we will escalate internally, and then we track, and then those things are fixed. The other thing is we have, of course, patient care coordinators, and these patient care coordinators, they move around, talk to patients, explain to them what their rights are and what their duties are as a patient and the patient relatives. So that gives a comfort. And then, so the technology is being used in all these things. For example, to take a feedback, we have a tablet-based feedback. So it's easy and it escalates. Now, the other aspect of technology for patients is giving good clinical outcomes. So good clinical outcomes can be from the equipment as well as from the practitioner. So from the equipment, we have the latest equipment, whatever is world class. For example, now we have a absolutely top of the line linear accelerator, so which has reduced the time for procedure significantly. So that's an example. So it is better for the patient. That's an example. Of course, when we had other installations like Gamma Knife, we were the first ones in South Asia to get it. We've had NAT testing for blood, which is safe blood for patients. Then from the clinical side, our doctors are using, e-notes so that it reduces chances of errors in the surgery. Now I just come to the infrastructure point of view from the patient perspective. We have latest building management solutions where we control the temperature across the hospital through a centralized area. Now the other area in a hospital which is important for the hospital is the area of productivity and cost, so that we need to provide lowest cost for the treatment possible. And there we have been using all the new technologies. For example, we are using Six Sigma to reduce the time taken in MRI, waiting time for patients. We are using projects to ensure that the changeover from ICU to the wards is easier and smooth and faster. We are ensuring that the room availability is faster. So that is an example. We have also been using tools for productivity within the hospital so that people do their work faster, quicker, and cheaper. Our focus will be to ensure that our clinical outcomes are the best possible. So for that, whatever needs to be done, whether we need to add new technology, new subspecialties, or newer ways of reaching the patient through technology, we are going to do that. We are also going to ensure that if the patient care is required outside the hospital facility, we will provide that to the patient. So we were the first ones in the country to introduce care at home. So our program has been doing well. And so we provide nursing services, we provide physiotherapy, we provide X-ray services at home, we provide sample collection at home. So we've been doing that. Our focus on care at home services are essentially what the patient needs. I am very, very optimistic about the healthcare industry in India. See, currently, healthcare industry will be in the range of 70 to 80 billion dollars. I think in the next 5 years, easily it will double, if not more. And growth rates should be in the range of between 12 to 15%, which is really, really good on a compounded basis. As we see, the cities are growing. So the more and more urbanization occurs, the more and more is the need for super specialized hospitals. Insurance industry, which is right now covering only around 25% of the population, is also coming out with newer and newer products, which are, some of them are covering even chronic diseases right now. So they are expanding the market. The only concern there is that most of the people are insured, but I think, in my opinion, they are underinsured. So that will also lead to growth in the industry. But having looked at that, there are some challenges also. For example, the challenges are that you need to have adequate number of doctors and nurses and allied health staff to provide the service to the patients, and which is where we have a shortage. There is a need to use different channels, use maybe digital technology, maybe use certain other manners, and maybe use some PPP with government and private coming together. My thought is that we've been having, uh, you know, maybe 70% of our healthcare concentrated in 30% of the urban areas, while our population is the other way around. So I think from all of us, the hospital providers and all the people who are in the healthcare industry, we need to be partnering with the state government and see how we can do betterment of the state. That, I think, will go a long way in improving the healthcare of the country.